Good afternoon. I'd like to call the Human Services Committee meeting to order, and we will start with the pledge, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I'm Jan Burdick, Chairman, and we will start with roll call, please.
Mrs. Burdick.
Here.
Mrs. Ricketts-Wales. Mr. Barnes.
Present.
Mrs. Hanchett.
Here.
Mrs. Root.
Here.
Mr. Rumfelt.
Here.
Mr. Stockin. And Mr. Harris. 6 present, 1 absent.
Thank you. And can I have a motion to approve the minutes of the February 21st meeting?
Root will make that motion.
Rumfeld, a second.
Any comments or concerns, corrections? All in favor? Aye. Carried. Now we will go to Anita Madison, Director of Office for the Aging. Welcome, Anita. If you'd like to highlight your report for us. And
Yes. So the report is the only thing we have on the agenda for me today. Some of the highlights, health insurance counseling for the month of January. We were up from this time last year and the previous month as well. And keep in mind, the previous month to this report was actually the end of open enrollment. So it's even higher than the end of open enrollment. Housekeeper chore, which is PC level 1. Our units of service are up from, again, 300 more units, almost 300 more units from the previous year at this time and up from the previous month. Case management is also up. Information and assistance, we're about 220 above last time last year and almost 500 above from this time last month. Legal services is up. 40 hours of legal services were provided in January alone. And then the other, which is kind of our catch-all, so it's things such as HEAP, home repair, COVID vaccine, scheduling, nutrition information, things that don't have in our statewide data system a certain spot that are reported out. Those units are also up from this time last year as well as last month. Does anybody have any questions on my monthly report?
how many people did you get to do with the drive with the drivers for the Meals on Wheels program?
Well, we're still actually scheduling people. So we've had a pretty good turnout, and we have had people reach out that maybe aren't doing it in March, but are scheduling in April and May throughout the rest of the year as well.
Okay, so just a reminder, if anybody does want to sign up, get hold of Office for the Aging, and they'll get you scheduled.
Yep, and anybody is welcome at any point in time. It doesn't have to be necessarily this month, but.
Anita, I was in a meeting last night, and the topic came up of transportation for some people that don't have a means of transportation, and it was, I think they in general were talking about any age, and then someone mentioned the Office for the Aging. Can you clarify that is only for what, 60 and over?
Yeah, so our transportation program is a state grant that we receive, so it does have to be for the age of 60 and over. We can't serve anybody under the age of 60. Our transportation program is a volunteer transportation program, so it is strictly volunteers. Volunteers have the option to submit mileage for reimbursement. Many of them do, but some do not. They do it out of the kindness of their heart. If you see here, transportation, we had 30 clients, 146 rides in the month of January. So we can provide transportation to medical appointments as long as the client is not on Medicaid. If they're on Medicaid, they have to use the MAS system, which we then help link them into. Grocery store runs, we can run to the grocery store either with them, take them with us. They can give us a list and we can go for them. So we have a 3-tier transportation program for groceries. To the bank, to the pharmacy, and any OFA-sponsored event. So we do, if somebody is limited in transportation, we will do to tax appointments that we are doing, but we always look to friends and family first because it is all volunteer-based. If we don't have volunteers, we would have to turn down any transportation because those are the people who drive for us.
Thank you.
You're welcome.
Any other questions for Anita today? Mr. Barnes?
Yes, last time you were here, I was asking you a few questions, and I was criticized by a fellow legislator as that I was harassing you. I hope that certainly wasn't my intention, and if I did, apologize. But
I appreciate that. Thank you very much. Thank you.
Any other questions? All right, thank you, Anita.
Thank you.
Next, we have Tyler Shaw, Public Health Director. Good afternoon, Tyler. Welcome.
Good afternoon. First up is my monthly report. Just a couple things to highlight. I think last time I mentioned we had 2 positive rabies specimens already in the county for the year, which is a little quick to have those, but certainly with the weather changes, we are certainly going to see that more and more. We did actually have another situation. We weren't able to capture the animal, but there was a skunk interaction with a person that we did send them for rabies treatment. So just wanted to put out some general awareness for everyone. Rabies is out there. We know it's out there. These are just the 2 that we found that were actually positive, but we know there are
The
hundreds
ticks are
of-
out there too.
Yes, hundreds of other interactions out there.
Mr. Healy?
Thank you. Can you identify the species that had their rabies?
Sure. Both so far for positives were 2 raccoons so far. Yeah. Some other highlights. So I highlighted the rabies. You'll see our children's services. If you turn to that page, our services, our evaluations are down a little bit, but you'll see that that's from January. So we just go based on what we're actually billing for those services. So you'll see it's a little bit behind. So likely that'll catch up, but we're pretty much on par with where we were last year.
Tyler, can I go back to rabies just for a second? In the original proposed state budget, rabies funding was cut. Do you know if it's been put back in, and how is that going to affect your department?
From what I heard, that was bought back, but it's in a general line item. I'm not sure how that's going to shake out at the state level. For us, financial impact, that grant is only about $14,000 for us. So if it did, get cut, we're covering that through our general public health works grant. Most of that anyway, so.
So you'd still be able to do rabies clinics?
Yes, yeah.
Thank you.
Just some general updates if I can. Just wanted to say thank you to County Administration, Mallory, Carissa, Tim, Alex, for their support, and our community partners, and especially my staff for the total solar eclipse planning that's going on. I do have 2 placemats that I just wanted to kind of show everyone. I handed one out, and I'll send this to Tiffany for the minutes too. I have it on Digits and Adobe. But you'll see these around the restaurants. We do have some placemats going out with some information and some vaccine preventable diseases on there. The red border one, some of it's going to be a spelling challenge. Some of those diseases are very tough. I struggled with some of them. So, but our answer key is on our website as well. Looking at some other things, we do have a free rabies clinic coming up on April 27th. That's from 9 a.m. to 12 p.m. at the Genesee Valley Bus Garage. Pre-registration is required. If anyone struggles with pre-registration, just give us a call. We can do that for them. And then lastly, our lead training survey is active on our webpage. If you go to government and click on health, you'll see a lead training survey for contractors. And that's for contractors that are interested in renovation, repair, and painting certification, lead abatement worker, or lead abatement supervisor training. And that's free through our HUD lead grant. So we're just kind of collecting interest at this point.
Have you gotten much response from it yet?
A couple, yes. Yep.
Good. Mr. Healy?
Thank you. Going back to your placemats there. And
Mr. Healy, your microphone. There we go. Thank you.
Going back to your placemats to get the information on vaccinate today there. Now, those are paid for. You have a revenue for the stream for those, correct? It didn't come out of the county dollar.
Correct. Federal grants, yep.
Yeah. And it had to be spent on something similar to this, correct?
Correct, yeah.
Thank you.
Go ahead.
Any questions?
Any
other
questions for Mr. Shaw? Okay, go. You have,
Okay. The only thing I have this month is a contract for Marco Technologies LLC, and this is for our WIC printer and copier at their office.
can I have a motion to approve that?
Root will make the motion.
Angela, second.
Any questions or comments? All in favor?
Aye.
Carried. Anything else, Tyler, today?
That's all.
All right, good luck with the eclipse and working on that. Thank you for all you're doing with the group. Thank you.
Thank you.
All right. Don Hurrian, Deputy Social Securities Commissioner. Welcome, Don. And
Good
Don-
afternoon.
we have several things to approve, but we're going to block several of them off together, so we can do that. So we can go ahead with the monthly report, and then we'll move on
Sure.
to your other stuff.
Yep. The only thing I'd like to point out on the monthly report is the Cold Blue Nights. We had 51 in December. We had 165 during the cold snap in January. That is fully funded by the state. Our allocation did cover all those nights for everybody that had to stay at the motels or hotels. Other than that, on the monthly report, everything looks pretty consistent. Any questions on that?
Okay, we can move on to the Youth Bureau.
Okay. Last year, there was a resolution approved for the Youth Bureau contracts. The contracts were written for the whole calendar year, January through December. After further research, the allocation only ran until September. The Youth Bureau is being switched over to the federal fiscal year, which runs from October to September. And there is a new allocation that's out for that, that right now we're in the process of determining how much money everybody will get out of that allocation in the new year. But we have to revise the contracts for 2023 from December back to September of 2023.
Have a motion for that.
Stockton. Rumpfeld, a second.
Does everybody understand that, what we're doing? Okay, any other questions or comments? All in favor?
Aye.
Carried.
Okay. Moving on to the Child Advocacy Center. The first one, we're looking for acceptance of an award and budget modification to accept $49,999 to support the operation of the Child Advocacy Center. This grant has to be spent out by September 30th of 2024. I have met with Dave Chambers at the CAC, and we are working with the state, and our plan is almost approved there. And we're going to use that money to cover salaries and fringe benefits and a couple of supplies.
Hanship will move.
We're going to do 4 of them, right? Under the
If you would like.
Child
yeah,
Advocacy
yeah,
Center, we'll
we
do
can
all 4
that.
together, and then one motion.
Okay. The next one for the CAC is the core grant. That's the second round for that. That was a 2-year grant that was approved last year by resolution. That is also worth $49,998. That one we are also using to cover the salaries at the CAC and fringe benefits. The next one is to accept and appropriate funds from the National Children's Alliance for the telehealth grant services. What that grant will be used for is we're running into a waiting list for the children to see mental health professionals. And we are going to use that money to try to hire a telehealth so the kids can start their treatment now. Right now, we're running a waiting list for that. And I checked this week, and we have about 10 to 12 kids that are on the waiting list waiting to be seen by mental health professionals. So hopefully this money will help us get some more help in that area.
Is that a waiting list through the county's mental health services?
No, it's just in general for like Clarity or any kind of services over in Olean. We're running into the same thing in social services where we're having waiting lists now for mental health and treatment. So hopefully this money will help us get where we can get online and do some things electronically. And the last one is custom lawn care. That is for snow plowing. We kind of missed this in the fall, so we had to put it on. This is a fee for service. When it snows, custom lawn care will come out, plow the driveway over at the Olean facility, and each trip is $55, and they only bill for when they show up. And that's all of them for the CAC.
Okay, so now we can have a motion for those 4.
Hanship will move.
Rumpfeld, a second.
Any questions or comment on any of these? Is there lawn to be mowed over there also, or is this just snow plowing?
No, there's lawn to be mowed, and we look for volunteers to do that
Okay.
in the summer. I work with that on with Tina Zaller, the secretary downstairs, and we always put a notice out or ask for volunteers this spring.
Thank you. Mr. Healy?
Thank you. This is for the satellite over in Olean, for the
Yes.
CAC Center
Yep.
satellite in Olean. And just briefly, could you remind the public and the members here what this the Child Advocacy Center is and what function it performs? It's a very needed service. Thank you.
Right. The Child Advocacy Center will take referrals from Child Protective Services, or they'll take referrals from law enforcement, and it's used to investigate and help treat children of sexual abuse, to get them through the process with case managers recommending mental health treatment, advocates to kind of hold their hand and walk them through the process, and then if there has to be prosecution, the Child Advocacy Center will assist in that also.
And that's, they do a lot with sexual abuse, but that's all types of abuse, right, with children?
Mostly sexual abuse.
Yeah. Thank you.
Any other questions or comments? I just have a comment. It's very concerning that these poor kids, they're already going through a lot of trauma, and now they've got to be on a waiting list to get any help with that trauma. Is there any resolution for that? Is there anything we can do to change that?
We're always looking for more providers to help. And hopefully, like with the telehealth, we can reach out and then we won't be limited to the local area. So, and hopefully we can reach out. Dave Chambers is working on that over there and reaching out. And it will be easier for treatment, and you can just use a computer instead of, say, drive to Jamestown or drive to Buffalo or Rochester or something like that.
The whole idea of the center is to try to minimize that trauma. Is that correct?
Yes.
Thank you.
Any other questions? All in favor? Aye. Carried. And now
Next
we
up
have
is
some-
Department of Social Services. The first contract will be for the drug and alcohol mandatory with a CASA. What we use that contract for is for everybody that comes in, we do drug and alcohol screening with them. And then if there's referrals or anything like that or further treatment that needs to be performed, we give them a referral to go to a CASA. The next one is for Catholic Charities SHAPE. That is another preventive contract in our services department for intensive treatment in the home and parenting skills, to get the family unit back on track and reunite the family. And the last one for Hillsides is another qualified individual, and that's more for the time limits that are set under Families First legislation by the federal government to get those reports and evaluations done so we do not miss out on the 4E funding for those cases.
Stockton. Ronfeld, second.
Any questions, sorry. Any questions or comments? All in favor? Aye. Carried. And then we have a few cooperative agreements.
Yep. Lastly, cooperative agreements. This is a state requirement that we write cooperative agreements, and they have to be approved by the state, and all these are approved by the state now. And the reason that the state has to approve them, they want to make sure that other county units aren't by statute supposed to do that under their units that they are working in now. So, and if the other units are doing work for us, such as the county attorney's office or employment and training, we can receive bills from them, and then I can claim and get federal and state reimbursement for those services that are performed by other county units.
So do you want to go through them and just?
Sure.
With each, you don't have to go into a lot of detail. I think that's
Yeah,
self-explanatory, but just say who they're with.
Yep. Allegheny County Employment and Training Center, they take the referrals from our employment unit. They help people do resumes, give them skills that they need to do interviews. Sometimes they'll buy interview clothing or work boots to get people ready to go back to work. The Allegheny County Attorney's Office for Non-Child Welfare Services. That's for any other services and social services such as Medicaid, like a regulation might change, or if a temporary assistant regulation changes, or any other kind of legal advice that we need, and we speak with Allison about that. Then we have the county attorney's office for child welfare services, and those are going to be for conflict cases that our attorney cannot handle, or if we have an overflow, the county attorney's office can cover those, so they can back bill us for those. The district attorney is for prosecution of welfare fraud. They have a choice whether they want to prosecute that or not, but we give them that money to prosecute welfare fraud and recover monies that are given out because people weren't very truthful. Information and technology. Information and technology is for Keith's unit. Darby Lavery is great with all of our computer systems. They make sure that our servers are up and running. They put in our wireless network. They really helped us with becoming very mobile when we went through COVID, when we got everybody Surface Pros and did all the mobile phones with hotspots on them. Sheriff's Office for security, we pay for 2 full-time deputies. One is a DSS deputy, and then we did a time study at MEG 1 and MEG 2 a while ago, and determined that the amount of people that were coming through there were coming to social services. So we got the state to agree that we could pay for one of those deputies that work the MEGs completely. And then our after hours is mandatory. We need a place for the SCR to call when we get a hotline report on a weekend, or if we have homeless people, they'll call dispatch, and they'll get a hold of our on-call people so we can take care of those situations when we're not in normal business hours. And all of those are reimbursable.
Great. Can I have a motion to approve all of these?
Root will make that motion.
Rumpfeld, second.
Any questions or comments? I have a comment. These are dated January 2023 to December 2023.
Yes.
These are for last year?
Yes, these are for last year. The state got a little bit behind, we got a little bit behind. 2 of them had to be rewritten and for those approvals.
So when do we approve 2024?
Hopefully we do it in 2024. That's my goal.
Okay. Thank you. All in favor?
Aye.
Carried.
Thank you, Don. Anything else you'd like to?
Thank you. Anything else you'd like to say today?
No, I think I did enough.
Okay, thank you.
Thank you.
Any old business today? New business? Good of the order, and I'll ask for motion for adjournment.
Rumpfeld will move.
Root will second.
All in favor?
Aye.
Carried. Thank you all.